We are in the skin, the integumentary system. The skin is not a piece of paper. If I cut your skin off, I peel it open, it's 2 meter by 2 meter square. It weighs about 4 kilograms. So it has a lot of structure in your skin. It's the biggest organ you have in your body. The skin can be divided into the epidermis and the dermis. And also we're going to talk about some appendage structures. The functions, first, is a physical barrier. It can also prevent the UV damage. Too much UV can damage. It can prevent water loss. It can have temperature regulation. You sweat. You can excrete oil and sweat. It's also responsible for vitamin D3 synthesis. So you need the sunlight, a little bit sunlight, UV, not too much. It will make your skin produce vitamin D3. And your body needs vitamin D3. And your skin is also a sensory organ. Your somatosensory, that's your skin. It also has the immune functions. Your skin cells, you have 4 different kinds of skin cells. The most abundant one is the first one, keratinocyte. Keratinocyte, it produces keratin. Keratin is a protein. Structurally, it's like a wax. So its function is prevent water loss. When the skin cells getting older and inside water will be replaced by keratin. So eventually they are dead cells, but they can prevent water loss. The second one is called melanocyte. Melanocyte, it produces melanin. Melanin is a pigment, and it gives you the skin tone, but its main function is to prevent the UV damage. So these are the melanocytes, and they produce the pigments. And these pigments will go into every cell, not just stay in the melanocyte. So your skin tone is very homogeneous. Next one, Merkel cell. The Merkel cell is for the touch sensation. And the last one is epidermal cells, also called the Langerhans cells. Its function is the immune function. So totally 4 different kinds of cells. And let's look at the epidermis. Epidermis, that's the layer the cell keep dividing. They start from this part called the stratum basal. And these cells gradually divide and push up. So from here to here, it takes about 2 months, sometimes 6 weeks. So 6 weeks to 2 months, your skin is new. And that's why after you damage your skin, you will have the new skin to cover you. And start from the stratum basal, it push up, it becomes the stratum spinosum. And it will go to the stratum granulosum, and either directly go to the stratum cornea or in the thick skin, like the skin in your hand. You rub them all the time. You have this layer, the stratum lucidum. So either 4 layers in the thin skin or 5 layers in the thick skin. So this shows you the same information. Start from the stratum germinativum, also called the stratum basal, B-A-S-A-L-E, and you will go to the stratum spinosum, stratum granulosum. So you can actually tell the difference. They look different. Then the stratum lucidum, then the stratum cornea. So they're gradually being pushed up. The first layer, stratum germinativum, also called the stratum basal. And that's the layers you have a lot of stem cell, and these stem cells keep dividing. And that's also the layers you have melanocyte, and they produce pigments, melanin. And you can induce the produce by giving them UV, more UV, because this is protective mechanism. And so you can have the UV tan to give you the darker skin tone, the healthier color, and that's because they can be induced by UV. Now the cells gradually being pushed up, go to the stratum spinosum, stratum granulosum, and to the stratum lucidum. So the cells become mature to about stratum granulosum layer. So in this layer, no cell division anymore. And they are mature cells, so they are ready to replace their water with keratin. So keratin start to accumulate. And stratum lucidum, only the thick skin have it. And if in the thin skins, they have stratum cornea. So once they reach the stratum cornea, that's the layers you don't have they are dead cells. So all the water inside being replaced by keratin. So we say it's keratinized. Advantage is water-resistant protein, so prevent water loss. That's why we can live in the desert, in those dry areas. Your skin prevents UV damage, but we still need a little bit UV because UV can help your body produce vitamin D3. How much do you need? Based on what I read, it's about 15 minutes per day. That would be enough. Too much UV can cause the damage, including the sunburn or wrinkles, premature aging, because the UV can damage those fiber in your dermis layer, and it can cause wrinkle. And these skin cancer. So a good picture worth 1,000 words. Why this gentleman, his one side of the face is 10 years older than the other side? Because he's a truck driver. So after 28 years of driving pickup, it turned out the sun always going in this side, so it damaged the skin and have more wrinkle compared with the other side. So this tells you not too much UV. And these two are cancer cells, the carcinoma and melanoma. Melanoma is much more aggressive. So these are the cancer cells. Indoor UV tan, it was pretty popular 10 years ago. And 10 years ago, the doctor found there are more skin cancer cases in young adults. Usually cancer happens in old people. And they suspect it's because of the UV tan. So if you're interested, this is a video show the girl who got skin cancer, melanoma, when she was 24. So it tells you, be aware of the damage caused by UV. Okay, now we go to the dermis layer. The dermis layers from here to here, that's the dermis, can be divided into two layers, papillary and reticular layer. There's no solid line for the separation, so you kind of have to use your imagination about there, and it's about 20%, 80%. The difference is the fiber. So this one will be tougher than this one. Okay, so let's look at the papillary layer. And that's the layers with loose connective tissue, areola connective tissue. So when we talk about the connective tissue, we say this areola connective tissue stay beneath the skin. So that's here, papillary layer. And that's the layer provide support nutrients to the epidermis. Epidermis has no blood vessel, so you can peel your skin off. But dermis layer has a lot of blood vessels, so all the capillary or lymphatic vessels are there. The other 80%, we call them reticular layer. In this layer, they put more fibers. So more fibers, tougher, stronger. So that's the layers with tough, dense. You use the dense, irregular connective tissue. So they put more collagen fiber. And that's the strong fiber, also more elastic fiber, and give you flexibility. So because of this layer, I can pinch your skin, it will bounce back because of more fiber there. If you like tattoo, you found tattoo lasts forever. It looks cool. Why it looks lasts forever? And we talk about the epidermis layer is just being replaced every six weeks, and tattoo lasts forever because it go to the dermis layer. So tattoo is they put the ink using the needle and put the ink go through the epidermis, go to the dermis layer. So it's here, and the epidermis they keep replacing. So the dermis layer, the ink will stay here forever. So you need to pick up a cool pattern because after 50 years, the ink will still be here. And one function of the skin is protection. It protects the bacteria go into your body. And tattoo, it penetrates your skin, so you need to be careful because if the bacteria goes through this needle, go to here, it can grow in the body. And that's why you can have the tattoo infection. It can be very serious. Okay, let's take a break.